A lot of flags. Jeez. There are always that many flags behind me? Okay. So good morning. We're here today to detail a new resource we're rolling out to kids and educators across the Commonwealth. I think most people know that Massachusetts has been a national leader in developing school testing programs since the beginning of the pandemic. There are over 2,000 schools across the Commonwealth that are currently participating in at least one form of testing that we make available. And right now, most schools are doing pooled testing, which is a surveillance program that we set up for schools to screen for cases on a regular basis last spring. The data from over a year's worth of pooled testing shows that school is an extremely safe place for educators and kids. Positivity rates in pooled tests are significantly below what you might see in the community overall. Even among a population that is getting tested more often than almost any other group of people, schools continue to see very small numbers of cases by comparison. The other testing program we made available is the so-called Test and Stay program. The way that program works is after someone has been identified as a close contact to somebody who has tested positive, those kids are given rapid tests every day for 5 days to determine if they test positive or not. This avoids the extremely disruptive at-home quarantine period. And the data from our Test and Stay program confirms without a doubt that in-school transmission is extremely rare, far more rare than transmission that is happening outside of school. Over 500,000 Test and Stay tests have been done, 503,312 to be exact, and 496,440 have come back negative. That's 99% of Test and Stay tests have come back negative. Remember that these tests are given to kids who are identified as close contacts in school with someone who tested positive, and out of 500,000 tests, 99% of them came back negative. Other states that have conducted Test and Stay programs or similar kinds of programs have seen similar results. A CDC study showed that similar programs in California and Illinois found incredibly low rates of secondary transmission in school as well. Clearly, in-school spread is extremely rare. And as we all know, young people are at much lower risk for getting sick from COVID. In fact, they are the lowest risk population of all. But this program requires significant resources, both in the form of tests and school staff time, to identify possible close contacts and then contact trace. School nurses and others have done an incredible job around the clock to make this program operate as effectively as it has here in Massachusetts, and it's been massively successful in avoiding days lost at home. But the current state of the pandemic requires that we adapt our efforts to meet the times. And that's why starting next week, our administration, through the Department of Elementary and Secondary Education, will begin distributing millions of rapid tests to schools across the Commonwealth. Schools have a choice. They can choose to opt into this new rapid program as an alternative to the Test and Stay program, or they can stay with the program that's been operating over the course of the past year. With this program, students and teachers take rapid tests home with them and test themselves once a week. This will be supported with the 26 million test order that we announced last week, and will be available over the coming weeks and months to make it work on a continuing basis. Schools that choose to participate in the at-home testing program alongside symptomatic and/or pooled testing will be able to discontinue contact tracing and the Test and Stay program. That will allow schools to focus time and resources on identifying symptomatic individuals. Schools will be able to start opting into the program for staff this week and will receive tests during the week of January 24th, and families will have to tell their schools if they want their students to participate. Tests will start to be distributed to schools for kids the week of January 31st. Commissioner Riley will talk more about the details on this in a minute. In-person learning has been proven to be the best option for students, which is why our administrations worked so hard throughout the pandemic to provide supports to keep kids in school. All those educators and local officials who've been stepping up to teach their kids in the classroom where they belong have been doing amazing work. This new testing program, based on conversations with school districts, is just the latest way that we think we can help keep kids in school. And while testing is an important tool, I would like to remind everyone, once again, that getting vaccinated is the best thing you can do to protect yourself, our educators, and our kids. If you haven't been vaccinated or boosted, please book an appointment. And parents, if you have questions, you should certainly talk to your child's pediatrician. The Department of Public Health will continue to support vaccine and booster clinics for students and staff, and so far have done over 915 clinics across 170 communities here in the Commonwealth. We will go to any school at any time that wants to run one of these clinics. Any school at any time that wants to run one of these clinics. We believe here in Massachusetts we have the tools to keep schools safe and open, and will continue to work with superintendents and local officials and school staff to do what we need to do to make sure that school continues to be a healthy and safe place for in-school, in-person learning. And with that, I will turn it over to Commissioner Riley.
Good morning, everyone. I'd like to publicly thank the Governor and Lieutenant Governor, as well as Secretaries Pizer and Sutters and Commissioner Cook from DPH, and everyone who works for the administration for the incredible hard work and commitment they've demonstrated to keep our kids learning safely in our schools. This new at-home testing program is frankly a game changer, and it wouldn't have happened without the dedication and collaboration of so many. Providing this option for at-home rapid testing will allow school nurses to spend more time identifying symptomatic individuals and focus their efforts on other aspects of COVID-19 management in our schools. Moreover, by providing at-home testing for our students, teachers, and staff who participate in the statewide school testing program, we'll be able to offer more testing every week than under the current Test and Stay program. Remember, the Test and Stay component of our testing program was developed as a strategy to keep unvaccinated kids in school by testing them after they were identified as a close contact. And it has been a great success. We've been able to save nearly 500,000 school days that otherwise would have been lost to quarantine. All of us owe a huge debt of gratitude to the school nurses who took on this massive task to keep our kids learning in classrooms. They spent countless hours, days, and nights and weekends to keep our kids in school. They are the true heroes among us today, and we are so thankful for all their tireless dedication. But at this point in the pandemic, we've also heard from many nurses and school administrators urging us to make changes to our Test and Stay program and the contact tracing associated with it. And both our medical advisors and the DPH say it's time to pivot. Again, Test and Stay was conceived and launched before every school-age kid was eligible for a vaccine. All school-age kids are now eligible for a vaccine, and to the governor's point, we strongly recommend they get it. Moreover, no one had access to at-home rapid antigen tests that we will be sending out shortly. And that changes the calculus. Massachusetts was one of the first states to launch Test and Stay, and the CDC, so many months after our adoption, recently jumped on board as well. But it is now time for us to lead again and change strategies to adapt to the current conditions of this pandemic. We need to pivot from strategies that worked in the fall to policies that are more aligned with how things have changed. Through the governor's commitment to purchase 26 million at-home rapid antigen tests for MyHealth and make schools and child care a priority, we now have an opportunity that wasn't available to us before. This new testing option will allow health personnel to focus directly on symptomatic individuals rather than identifying asymptomatic close contacts. At this point in time, we need to shift our attention and resources to mitigation efforts. Schools that want to keep the testing program they currently have in place will be able to do so, But we recommend they make this switch that will enable them to provide weekly at-home tests. As always, we are committed to using available data to inform our recommendations to schools and districts. This new option will give Massachusetts school districts more flexibility and resources in COVID-19 testing that will have the most immediate impact to keep our schools open. The at-home test will be shipped directly to school districts for distribution and are packaged in kits of 2. Students and staff who participate will receive 1 kit every 2 weeks to test at home. If an individual tests positive, they must inform their school and their healthcare provider of the result. Schools will report positive cases to DESE as part of our weekly COVID-19 reporting that is already in place. We continuously look at the data we have related to our schools, as well as what innovations we have available to improve our testing program. Today, we are bringing together both this new testing option for everyone for better results for our kids. Thank you.
You should probably stay there.
Yep.
We'll start with them. Then.
Yes.
How will reporting work? Are people required to, with this at-home testing kit, students are required to report their results and staff?
Yeah, we're asking parents to sign a permission slip in which they agree to either look at the video or get the directions on how to give the test. And then if it's positive, we ask that they commit to calling the school and letting them know that they're positive. That in turn will be put into our system that's currently in place for positive cases.
How many tests are going to be dedicated to this particular program out of the 26 million?
So I think it's a little too early to say because it's an opt-in program. We'll have a better sense of that in the next week or two as districts make a decision.
Do you also then have an idea of how long the supply will last?
Yeah, our thinking right now is that right now we're going to start the program through April vacation and then make a decision later in the spring based on the situation on the ground.
School districts decide not to do this ship and stay they have a big responsibility cost if they continue with the current testing.
If they decide to do the current testing, it will be the same program they do now.
The 2 tests, you said everybody be sent home a kit with 2 tests.
Yeah.
And they'll get it every other week, so they will do 1 test 1 week and then the next.
That is correct. Yeah.
So I don't quite understand, the key to these at-home tests is doing it when you're possibly exposed, right? So how do you decide when the right time is to take it?
Not necessarily. I think districts are going to advise families on the best time to take the test based on when they do their pool testing to maximize the effect. So remember, a lot of districts, many districts right now are doing pool testing. Let's say they do it on Thursday. They might want the kids to take their at-home tests on Sunday. Or if a district is doing the pool testing on Monday, they might want the kids to do it on Wednesday or Thursday, so they spread it out and get maximum coverage. Does that make sense?
So if the pool testing shows someone is positive, then they say, test if you're that positive.
No, we're asking people to test regardless if they're symptomatic regularly, so it's coverage. But if you get positive in a pool or if you get positive in a home test, then obviously we ask the kids to stay home.
So the shift to this is also a recognition of seeing that the schools are dealing with staffing issues. The nurses' offices, they don't have the resources to continue current system.
You know, I think we certainly, like every other sector in the country, have staffing issues. I think the nurses have gone above and beyond what anyone could have asked of them. But this is something that is just better for our kids and gives more coverage, and it, at the same time provides them more relief so they can focus on symptomatic cases.
Will the districts be in touch with parents on when to conduct the test?
Indeed, I would imagine that will be the case.
And that will be uniform?
No.
among schools?
No, remember, districts do pool testing on different days, and even some schools do them on different days within a district, so it'll have to be specified based on when the pool testing is being done.
Wouldn't it be the best of all worlds, commissioners, to be able to continue contact tracing plus at-home testing? Or is that just,
The data doesn't support it. The fact that we're doing so much testing of kids once they get in this test and stay program and they're being found to be negative, so it doesn't necessarily support that, I think. We've got a better way to get more coverage by sending the tests at home.
is this a recognition that Omicron is not as dangerous as previous strains?
I don't know if that's a recognition. I think it's all built into the calculus on what we're trying to do on an evolving basis. But the reality is we know the kids are the best place for kids is at school. And we want to do everything we can to make sure that kids can stay in school, but also keep them as safe as possible. And
What is your guidance for kids once they test positive? Are you sending kids home with, a sheet of paper telling them it's 5 days mandatory? How is it going?
so that happens at the school level, and usually it's done with a phone call and sometimes with a letter as well. But you'd have to talk to each individual district about how it's done.
Do you know how many school districts are going to be participating in this new program, or are you just literally rolling it out now?
We're rolling it out now. People have the option to kind of buy in. And we're asking for districts that want to do this to try to get us the information back as soon as possible. Those that get it back sooner will obviously have priority, but we recognize that because it's a local decision, it may take some time to get this up and running.
Will districts that choose to do this get enough kits for every student in the system, or is it going to be a percentage?
No, it's for any parent or staff member that wants to do it. They got to sign the form and they're in.
So if parents could sign in, even if a district didn't do it overall, it's literally each individual parent in each district?
No, the district has to make the decision first that they want to be in. And then if they do that, part of being into the program is that they get the permission slips from the parents.
Do you have enough tests to go through the rest of the year for all the districts that decide who opt in and not opt in?
Yeah, I don't think supply at this point is an issue. We may need to look at this in the spring and see what the cases are like. And for example, would it be better to stockpile some of these tests in case there's a future surge? I don't know. Those are decisions that will happen down the line.
Well, right now, you're comfortable with the supply that you have.
We feel confident at this point.
The pool testing would continue alongside that home? No, that's it, yeah.
If that's what, pool testing is part of it, yes.
Last question. Staff as well, or is this just?
It's for staff as well, that buy into the program. So most districts, not all, but most districts will do symptomatic testing, pool testing, and then if they choose this at-home option as well, they'll do all those three things.
There was another layer of safety, is that fair for me to say?
Yes, and it's a layer we didn't have before.
Thanks, everybody.
Governor, can I ask you about,
Yeah.
stuff here? The legislature.
That was excellent try, Fair. I really appreciate that. Yeah.
That's what reminded me to ask him the question. The legislature needs to pass some kind of voting bill, either extend remote voting, mail-in voting, or to go even further, as the Senate did last session. Where do you stand on that? Because that is something that definitely has a timeline. Are you hearing from municipalities that are worried that this isn't going to get done in time? What does the legislature need to do?
Well, certainly, I think did we pass that bill in the spring last year? I mean, it was like May or June, wasn't it? It was. Look, people always would like something sooner rather than later, but I think last year with all the 2 years ago, with all the significant issues we were dealing with in 2020, I don't think we got that bill until June or July, and we still managed to have it up and operating by Election Day. So I guess what I would say is I assume this will be part of the legislative agenda between now and the end of the session, and my guess is that sometime this spring would probably be the time frame, and I think that will be okay with respect to people's ability to implement it.
Even municipal elections?
That's going to be a different issue, although municipal elections generally are, because they're local, they tend to be a different kind of election to begin with. I mean, I think I would love to see something before that, but at the same time, I think most communities have figured out how to do their municipal elections, and my guess is that it's more likely we'll get something after that than before that.
Are you open to expanding voter access beyond just extending mail-in voting?
Our policy since we took office, especially on complicated stuff, is to give the legislature their opportunity to process and deliberate. But we don't comment on this stuff until we actually see the final product.
Governor, on the testing, how does at-home testing as a pivot at this stage of the pandemic make more sense than test and stay, which you talk about a lot, has been so successful?
Well, I mean, I think one of the things we're trying to do here is to give communities a choice. I'm a big believer in the test and stay program because it kept kids in school, and it also demonstrated once again that there is not a lot of in-school transmission. The fact that we did 500,000 test and stay tests and basically came back with almost 500,000 negative tests against kids who were close contacts of kids who tested positive is a pretty clear indicator that in-school transmission just doesn't happen very much. But I think at this point in time, we wanted to give districts the ability to add a layer of coverage if they wanted one on top of pool testing. And several of them said to us that with a lot of the staffing issues and all the others concerns that they've been dealing with, that many would like an alternative to the test and stay program and chase symptomatic cases and use this as the alternative to the test and stay piece.
How about in terms of government, you obviously, the at-home infections, you have a lot of your schools, still very difficult for people in general to get them. Is there anything that you can do, the state can do, to make that process more easy for the general public in terms of getting at these kids?
Well, the big thing, and I've been talking to the federal government about this for months, is to approve more rapid tests. I mean, there are hundreds of these companies that have been approved in other parts of the world, including most of the Western democracies, and therefore they have a lot more tests available, and they cost a lot less because there are a lot more people producing them. We had a handful of these companies that have been approved in the U.S. as recently as a few months ago. And even today, I think the number that are actually operating under an EUA from the FDA, I think it's less than 15. And that has huge consequences with respect to the general availability and the price point that's associated with this. Part of the reason we went directly to one of the manufacturers that have been approved before the holidays and purchased those 2 million tests we distributed to cities, to 102 cities and towns around Massachusetts, was to try to get more of these tests into the community. And I think as we get a sense about how these 26 million tests are actually going to roll in and how many folks are going to sign up to participate in the program here, how many we're going to need for early care and education, you know, we'll make a decision at that point about whether we can make some of those available to the public as well. By the way, you should know that I think at this point, somewhere between 60 and 70 communities, entities that are able to purchase off the state's blanket have done so. Salem, Springfield, I mean, there are a bunch of communities that have these tests and have started to distribute them off that blanket, and I think roughly somewhere between 700,000 and 1 million tests have been delivered. So there's activity going on at the local level as well as part of that contract we put in place, and I know they're taking their tests and distributing them through libraries and community health centers and senior centers and places like that.
Do you see the state ever dealing with the federal government, do you order them, they'll send it out to you, or is that just too much of a hassle?
Well, we've already got and delivered more tests to people through the program we put in place, and we'll continue to chase those options as they become available to us. But the biggest challenge we all face when it comes to rapid tests generally is the lack of a large number of companies that have been authorized and approved by the federal government to manufacture and distribute them here in the U.S., even though they're everywhere you go in Europe.
Governor, what's the state going to do for these folks that are getting messages now that they want the unemployment insurance money to come back? They thought they got that money free and clear, that they were entitled to it. Now they're told that they're not. Is the state going to do anything to help these folks?
Well, there's certainly going to be, there is an appeal process, and obviously a lot of the work that we and they will have to do to sort of figure out the answer to this is going to have to be done sort of on what I would describe as a case-by-case basis. There are a lot of very particular rules and criteria associated with both the federal and the state program that sort of got put together during the course of the pandemic. And, you know, in a program where you would normally put, you know, $1 billion a year out the door, we were putting 10, 12, 20 billion out the door. And I think it's going to be important for us and for the folks who receive those notices to make sure everybody understands exactly what their situation and their circumstances were, and we'll work through them as best we can. But there is an appeal process, and there are state rules and federal rules on this, and we'll do whatever we can to make sure we create as sort of accessible a process as we can with respect to dealing with that.
Thanks, everybody.
The mayor of Springfield has been requesting National Guard members to help with testing in the city. Do you know any more about that request?
So we obviously talked to Mayor Sarno quite a bit, and we did open up some additional testing, mobile testing capacity over the weekend, and I checked this morning to see how we were doing with respect to availability, and most of the sites in Springfield right now either have no wait or 5 minutes or less, and we'll continue to talk to them. Springfield is one of the communities that did order early on the rapid tests and did get a couple of pallets about a week ago, which I'm assuming the mayor's distributing along with the work that's being done on the testing sites as well.
Has the vaccination card website been a success? Do you have any idea how people have used that?
I don't know the answer to that. We can get back to Mike on that one. Most people who've used it said it was relatively easy to use, which I think was, from our point of view, is the most important part about that. And a lot of the people who've used it have said that they're particularly, the thing they care the most about with respect to it is they can have it for travel purposes, because they expect and anticipate that they'll need it.
Any bumps on the technical side, or people requested records that aren't there?
I think the biggest bump on the technical side is a lot of people can't remember what the actual, how they put their name in or what their contact was when they signed up for it. Because if your name is Timothy, and you can't remember if you did Tim or Timothy when you signed up for the thing, or if you put in your middle initial or you didn't, that's like a legitimate issue with respect. So some people may have to go more than once just to get through it. You will get, if you don't succeed the first time, you will get, if you give them your email, an email from them, which then makes it possible for you to pursue on a sort of question basis what actually is the issue and the problem there.
Governor, the House Ways and Means Committee is doing $50 million bill. I don't know all the details, but it includes like $20 million for masks. Is this something you've talked with legislative leaders about? Do you need this money for masks?
We have about, I don't remember the exact number. I think we have somewhere between 6 and 8 million. I can't remember. We'll get you the numbers in a warehouse right now. I think, I'm not familiar with the bill. It's hard for me to speak to it.
Ask them for some money or additional help plan.
Well, the biggest challenge we have with respect to testing is much more about staff than it is about either supplies or dollars. We think keeping, and I said this when I was talking to the Oversight Committee last week, we try to keep about a 6-month supply of masks on hand. If this would be funding that would make it possible for us to continue to extend and expand our supply with respect to masks, then obviously we would put it to work that way.
Governor, there was a lot of reporting on the wastewater levels at Cedar Island. Just talk about when we're at the peak from what you guys are seeing. Are we in it right now? Are we still a ways to go? What do you see as far as this peak problem?
I think the wastewater data, which we started collecting, the original collection I think started in the summer of 2020, and we've been sort of adding additional sites to it ever since then. The current state of play on the wastewater treatment data, generally, the broader collection of data, is it's down probably somewhere between 65 and 75% of where it was at the peak a couple of weeks ago, which is exactly the same trajectory that people saw with Omicron in the UK, in South Africa, and in other parts of the US. It's one of these. It's straight up and straight down. And several people have written about this and said that this appears to be good news. The one thing I would say about COVID generally is you just never know, but it certainly does look like we are very much on the backside of the Omicron surge in Massachusetts.
Thanks, everybody.
Thanks, folks.